everyone. Hello, everyone, and welcome to part 2 of our lecture series concerning Chapter 1. So, in our last part of the video, we were looking at different case studies and how they demonstrate abnormal psychology. And we were kind of tying it into popular culture and what's going on today, a little bit in the news. But again, so what we really want to examine is why a behavior is considered abnormal. Because you and I, let's say we see someone walking down the street with a bunch of piercings, their whole body tattooed, and gauges that just went down to their shoulders. You and I may have difference of opinions if that's abnormal behavior or not. So how do we settle upon a definition of what's abnormal? Well, a lot of abnormal psychology is going to be the scientific study of abnormal behavior. There's that word again, that troublesome word. Undertaken to describe, predict, explain, and change abnormal patterns of functioning. As we've come to try to describe this term abnormal, it raises questions. So the more we try to set these parameters, the more questions that are raised. Sometimes people are just eccentric. How does eccentric differ from abnormal? How is abnormality informed? A lot by culture and social norms. So our culture where we live, it's the traditions, these can be religious or social, what have you, of the area that inform our norms. Our norms are kind of these rules we have for our different conduct, rules of social conduct. Sometimes they're stated, sometimes they're not. I think I had that on the next slide, actually. There we go, yes. So, rules for proper conduct, which are going to stem from our culture. And these things can change with region or time. So, that's kind of the trouble we have with defining abnormality. So, while a set definition hasn't been explicitly agreed upon, there are factors of abnormality that most clinicians can agree that if these things are present, the behavior would be considered abnormal. And I'll give examples to help elucidate this. So we're going to look at 4 main characteristics. So just remember the 4 Ds: deviance, distress, dysfunction, and danger. And we're going to talk about these. So with deviance, with my tattoo example, for example, deviance, when something deviates, it's kind of straying. Okay, so think of it in that sense. So deviance is not necessarily like evil. I think it kind of has that connotation. Deviance is when something deters from the point or the norm. So if we saw someone in the United States walking like this man above with tattoos on every inch of his body, even some injectable tattoos, it looks like, gauges and the piercings everywhere, that would be considered abnormal, I would say. Even though tattoos are becoming more mainstream, I think someone with that extreme of body modifications would be seen as kind of abnormal by most people. Whereas the man on the bottom, he has a lot of tattoos. They're very tribal. He's from the Maori population in New Zealand. So in that culture, in that cultural climate and his tradition, these tattoos are seen as a norm. So it's not an act of deviance to kind of have those tattoos from head to toe. And I'm just using tattoos as an example because I feel like it's one of those controversial topics we talk about. But you'll see that norms, those rules for proper conduct, can change from culture to culture. And they may change over time. So when looking at the circumstances of a scenario, we have that case study 1 where we talked about Joanne. Well, if she lived maybe in a really nice suburb of the United States, and didn't have any socioeconomic concerns, then that behavior and those thoughts would be considered abnormal because the circumstances don't really dictate, her fears, if that makes sense. And I don't want to misspeak, so I'm very careful about my language I'm using. But if she was in an area, like I said, where she was a refugee and she was fleeing a war-torn area, or gang violence in a different country, then that response maybe seems more normal. Okay, so again, it's dicey, but circumstances dictate when something's viewed as normal or abnormal. And again, how do we know an appropriate way to respond? That's a good question. So it's kind of hard to determine someone's response. Let's say someone has their um, someone special in their life passes away. One person may react entirely differently than another. Maybe one person finds solace in their religion and their faith, to keep that person alive on some ethereal level. And maybe another person just totally, quote unquote, goes off the deep end, isolates themselves, doesn't want to participate in anything for a little bit. So there are different responses to similar scenarios. So it's kind of hard to say, well, that's the wrong response. Do you see what I'm saying? And so that's why we also look at distress. So distress, these four factors kind of have to be present together in some measure for behavior to be abnormal, because someone could engage in deviant behavior and it doesn't distress them at all. They revel in it. They love it when people look at them for all their tattoos and body modifications, for example. So sometimes you look at distress. Is the behavior, the thoughts, or the feelings that this person is having, is it causing them personal distress or people around them? And distress can be defined, easy Google search, extreme anxiety, sorrow, or pain. So like the little boy in this GIF. I don't know if you all have seen that clip, but it's very cute and sad at the same time. So an example is anxiety disorders. The thoughts that people have when they have anxiety disorders of excessive worry. You know, we all worry from time to time, but at what point does it become excessive? And that's what we're looking at with the distress factor. If it becomes so excessive that they think about, you know, death or germs or someone getting hurt every second of the day, it causes them distress. They're fearful. They're going to change their behavior to try to avoid that stress from that thought. It may in turn come out on their family. They may isolate their family in some sense in their behaviors. Let's say this pandemic has caused a lot of people some distress, right? So it can affect your behaviors and how you think about other scenarios. I know for me, I haven't been in physical contact with anyone since March until I went back to work last week. So it was a little distressing for me to engage in close conversations with people, and I don't go near anyone who's not wearing a mask, and that's on anxiety. But anyway, just a little example. But distress is important because sometimes it doesn't cause the person's stress to behave abnormally. Like I said, that could be an eccentric person. Sometimes they're personality disorders. So if someone, let's say, has narcissistic personality disorder, they believe they are the bee's knees. They believe that they are the next coming of Christ, for example, if you know that phrase. They believe they're good at everything, but they don't have anything to substantiate the claim. They really want to focus people's attention to themselves, right? That's not distressing for them, but it is distressing for other people around them. But that's still an abnormal behavior with other features of dysfunction and possible danger to others. I hope I haven't lost anyone yet. If you need clarification, let me know. I know it's kind of hard to be... I don't want you to feel like you're bothering me. This is part of my job. I'm trying to explain it succinctly, but also with detail. Then there's also dysfunction. So if we go back, dysfunction. If something's not functioning the way it should be, right? So if a behavior, a thought, or a feeling disrupts the person's daily functioning, that is another sign of an abnormality. Okay? So for example, we're going to go back to anxiety disorders. If someone is deathly afraid of catching COVID, it's not exactly abnormal right now because it's talked about in the news. It's something prevalent with our social norm and what's going on in our country. But if this person locks down in the house 24/7, see, that's a bad example because some people are doing that and some people view it as abnormal or not. Let's say Let's use germs in general. Let's say someone has an extreme phobia, germophobia. It's okay to be wary a bit about, being clean, washing your hands after using the restroom, for example. But if you enter their home to talk to them and they want you to wear gloves and a face mask, outside of pre COVID days, right? That would be abnormal. Sometimes that may lend people to not want to go to that person's house. Maybe the person with the germophobia doesn't want to see people at all. That's starting to interrupt with their daily functioning. So we're looking at how an abnormal thought or behavior affects social interactions, how the person is productive at work, and if they're maintaining their self care. Maybe some people develop an extreme fear of water, so they do not want to shower. So these are different things that we're looking at with abnormal behaviors. And danger. This is important to note because this is an exception rather than the rule. A majority of times, people with psychological disorders are not dangerous. Majority of times. I would say like 3 out of 4, okay? But it gets on the news a lot, and so it kind of changes the mindset. We always see like the serial killer, that movie Split, where the man's a serial killer with dissociative identity disorder, and he's really sick and twisted and tries to murder people. We see that narrative a lot, and so it makes it seem like that's the norm. But a lot of times, for example, people with anxiety disorders try to protect or avoid harm to themselves or others. But that's not to say it can't happen, as is the case of self-harm and suicidal thoughts and attempts, for example. So these are what we're looking at. Deviance, distress, dysfunction, and danger. So let's go to treatment. And I'm going to try to be a little more succinct on my time for you all. But treatment is going to be a systematic procedure designed to change abnormal behavior into more normal behavior, also called therapy. Systematic means that you follow specific steps. Now, if someone is depressed and their friends say, hey, let's go see a movie, that'll cheer you up. And suddenly that person, let's say his name's Bob, he gets cheered up by the movie. That's not therapy. Or when people say, hey, let's go shopping, retail therapy. That's not therapy. Therapy is systematic. There are steps to improve. You can engage in hobbies and things that certainly may help you feel better, but that's not specifically therapy, so that's important to know. And sometimes, treatment can vary. So clinicians who view psychological disorders as an illness may seek to cure the patient. So that verbiage is important in how they view the situation. And if the clinician sees it as a problem in living, maybe that person's been conditioned or reinforced to behave a certain way. They maybe see themselves more of a teachers, where their job is to teach more functional behavior and thought to the client. And these roles are going to differ. Psychiatrists are medical doctors. This is a really good chart I'll show you later, whereas psychologists are specifically trained in psychotherapeutic techniques. But what's important about therapy that's going to differentiate it from other tasks that make us feel good? We're going to look at Jerome Frank. He coined 3 essential features of therapy, and I think this is a good rule of thumb to help you understand what therapy is. So there's going to be a sufferer who seeks relief from the healer. There's going to be a trained, socially acceptable healer whose expertise is accepted by the sufferer and his or her social group. Now, please note, you see how this definition is kind of general? Well, a healer is kind of open beyond a psychologist and a psychiatrist. A healer could be maybe a religious figure. If the person who is suffering is invested in their faith, maybe a figurehead in the faith, they see that as someone who can heal them. So again, take these with a grain of salt, because while they are attributed, we're looking at therapists and psychologists who spend many years extensively studying these sorts of methods and disorders. Sometimes there are community healers people look up to, which, may or may not be as qualified. And third, a series of contacts between the healer and the sufferer, so multiple meetings, through which the healer tries to produce certain changes in the sufferer's emotional state, attitudes, and behavior. So there's that seeking of trying to amend the behavior, maybe get rid of unwanted thoughts, maybe change their perspective on how they're feeling to get it to a more normal state. And I'm going to pause this video here for part 2. Stay tuned. Part 3 will be the last one.